matter. It doesn't matter the breed. We will weigh the dog. Good lad.
I undershot by 10 kilos. But
So what? He's 80. What? 81 kg. Jesus.
And there's not a spare tire on it.
Jesus. What's he been eating, Mitch?
Uncle Benji.
Uncle Benji's. Jesus. So here we have young Omar, Central Asian of Charka, and he is just coming just to have his ears checked. He's a nice boy, and it's really important that we get all these things done as a principal. Good lad.
Good boy.
Have a boy.
Good boy.
You've done so well.
Good
We want to get a good look in his ear. So what we're just showing you guys is this. You know, we are prepared to see the largest of breeds. We make sure that we take care of all the dogs, and if he needs an ear flush. How's he looking in there?
He's looking like he potentially might have an ear infection.
There we go. So we want to make sure.
Good boy.
We're a little bit moist. We've got a little bit of kind of mucky discharge.
Sure.
He's a little bit pink,
Right.
and he's also got a little bit of inflammation on the wall of his ear canal. Yeah.
Good.
So
Well spotted, Mitch. Mitch is well done, young man. So he's very good at spotting these things, and what we just do is make sure all the animals are looked after.
Good boy.
Good lad. So he's going to get some treatment now.
He's going to get his other ear checked.
He's going to get his other ear checked, which is great.
So that's basically what's come out.
Wow.
Lots of nice kind of mucky
Many vets
discharge.
would turn a dog like this away. And for obvious reasons, but because of our training background, we can make sure the dogs are not out of control. You've got to understand from a vet's point of view, why would they put themselves at risk? Good lad. One of the performance promises that we have at Noah's Ark is a strong focus on the resolution of chronic ear infection in dogs and cats. I speak from a client's point of view. So we are going to make sure that we test, we swab, we do the cytology and send off the samples.
Instant blood testing.
Instant blood testing.
So
And what does that mean?
Same day results. So we run all of our blood samples and urine samples in-house. We get the results within about 6 to 8 minutes after inserting them.
And what we understand in the industry, far too often, diagnosis is something that people are not testing enough, and it's leading to more of a generic treatment rather than a specific treatment.
Yeah.
And that's where people have these reoccurring concerns. What we want to do is find the raison d'etre, the real reason behind why your dog has an ear infection.
Reoccurring.
Yeah.
Yeah,
So we get the facts, and then we can treat accordingly.
definitely.
Good boy.
So I can't. So this looks like a yeast infection to me.
A yeast infection. Yep.
Malassezia.
Uh-huh.
So I am able to prescribe some ear drops to tackle that.
Lovely.
We also do have the option of doing an ear swab. So
An ear swab. Okay.
I will leave it with you as his guardian.
Sure. So I think that potentially. So what type of ear flush would we be using, or ear drops?
So for,
Keep talking to him.
Good boy.
for Omar today, I probably would just prescribe some Cereline for him.
Cereline.
It's got anti-inflammatory in it. It's got some antifungal in it.
Sure.
It's also got.
As a baseline, and
As a
then
baseline.
when would we check and see if that's progressively working?
Probably 7 days.
All right, okay, so many of you, I know the cost of swabs, etc. is a problem, so we can do a principal treatment, and in that principal treatment, we can give you
Good boy.
a general treatment.
Good boy.
So we go in,
Good boy.
we're looking in this ear,
Boy, well
good
done.
lad.
Boy.
We'll give you a general treatment, and if that doesn't work, we can do
Okay,
a much more thorough.
Good boy.
So,
That is
similar kind of
similar,
thing.
yeah.
I'll
Okay.
show you.
Good boy.
a kind of dark waxy discharge with a bit of inflammation,
Sure.
redness in the ear canal.
Excellent.
Okay, but milder.
So, mild. So
So
basically, we want to just get those eardrops in, and happy days.
Good boy.
Perfect.
Thank you so much.
Very good.
What was the name of the eardrops that we're giving him?
Cerelan.
Cerelan. Wonderful. That's a prescription
Good
only.
boy.
It is a prescription only
Yeah.
medication. For
Come and
dogs.
see us if you've got a problem. We have a dedicated team here to help all large breeds of dogs. Thank you, Doctor.
You're very welcome, Ben.
So, prescribed. That's our veterinary clinic over there. And this is us treating the dog. Keep talking to him.
Good boy. Good boy.
Excellent. And how many times a day has he got to have that?
There's 7 drops in each ear.
Right, okay. Please feel free to call my team for some support. We have a very skilled team of vets, vet nurses, receptionists, with a fantastically well-equipped facility. I have over 2 decades in professional canine husbandry. I am a very, very fussy customer. I can assure you, your customer experience will be excellent.